Hey all, I am here to talk today about something that is kind of horrifying, right? It is like so scary when it happens. I have moms and dads calling me up panicked. What do I do when this happens? It is so common though, and it tends to happen in this kind of late March, early April time of year when we're heading into our springtime. Do you have any idea what I'm talking about? It's nosebleeds. Oh my goodness. So we have our kiddo nosebleeds. The blood is just pouring out. It looks like there was a massacre and parents are freaking out what to do. Sometimes these poor kids, they like tilt their head back, they swallow all of this and then they start throwing up blood. It looks even worse. Or maybe it goes through their tummy and then they have really black poops and that even looks even worse. And it can be so scary. So do you need to be scared? And what do you do about it? How do you stop the bleeding? How do you prevent the bleeding? Do you need to run to the ER? Or what are we supposed to do? So I'm going to talk about all of that today. Thing to know is that nosebleeds are pretty common, especially this time of year. When allergy season is in like full swing, especially in the very beginning weeks of allergy season, when we just see pollen on the tops of our cars everywhere, when we see it on our windows at home, where we just see it everywhere floating in the air. Sometimes we can see it, and that is when we are in our peak allergy season. When we are in our peak allergy season, the inside of the nose gets very wet and moist from all of that running. Sometimes we're wiping like this. Sometimes the kids are putting their hands up, which we call the allergic salute, and we are just moving our noses all around. The inside of our nose is very similar to our lips, right? And when we lick our lips too much, right? When our lips are too wet from not the right stuff, they can actually get really dry and crack. And the inside of the nose is very similar. So what happens is when we have all of this mucus running nonstop, we're wiping our nose like this, moving that nose around, pushing it up for the allergic salute. We are just moving that skin around, and sometimes, you know, especially in our little kiddos, we even stick a finger up in there just to kind of get out any boogies that we feel or any hard things that we feel. And then what happens is we get a crack in the inside lining of our nose, very much like we might get a crack in our lip. But there is a place in our nose right about here, but on the inside, that is a collection of blood vessels called the Kesselbach's triangle. And this area has a whole bunch of blood vessels, and the skin over those blood vessels is so thin that it just takes a tiny little crack, and then suddenly we have like horror movie type blood coming out of our nose. And this skin there is so thin that it's really easy to do. So this is why we have so many frequent nosebleeds when we are struggling with our allergy season. Some kids have allergies all year long, struggle with nosebleeds all year long. Some kids only get it, when they get colds, because they don't really have allergies, but they get a really bad cold and they're going to get a bloody nose. And it's just this idea of cracked lips, but instead of cracked lips, it's cracked skin inside the nose. So what do we do if we get a bloody nose? So first thing you're going to do is you're going to find that hard spot of your nose, right? So this here is all bone, and there's cartilage here, and it's harder to tell from this part. But if you go in this part of the nose, and let me take my glasses off so you guys can see. If you go to this part of the nose, you can feel bone, and then we're gonna find where the bone meets soft, right? And you can see this is soft, and you can see that this is bone. And so we're gonna push in this place where the bone and meets the soft, and we're gonna push our fingers together and then up, okay? And then you're gonna have your kid's head tilted forward. And that way, we are putting direct pressure on those blood vessels that are bleeding, and we are tilting the head forward so we are not swallowing any of that blood. Our body doesn't really like blood very much. It's in our vessels, right? It doesn't like it in the tummy. Blood is going to make your kiddo very nauseous. Probably they're going to throw up. It's going to be horrible looking. It's going to be petrifying. Even if you know that it's like okay, it's just not fun to see your kid throw up with blood in it. If it goes through the whole tummy, it's going to give them a tummy ache, and then the poop looks really black, and that's because digested blood looks black. So these are things to know about. And then, so you hold that there until it stops bleeding. Every now and again, you're going to take your fingers away and see if there's any more blood dripping. If there's still a little bit of blood dripping, we're gonna hold it longer. You're gonna take an approximate timing of this, right? If it takes more than 10-15 minutes for that blood to stop and you are pretty sure you are holding firmly and you are pushing hard enough to make it stop and you're pushing in the right place, then that's when it's time to maybe call your doctor and see if we need to do something else. Most of the time, this will do it in 5 to 10 minutes or less. Again, you do have to hit a pretty good amount of pressure. So, have you ever had your blood drawn and they put pressure on your arm to stop it, or maybe an IV and they put pressure? It's about that much pressure. So it's a pretty good amount. Not so much that we're like hurting our children, but a good amount because we're trying to stop that bleeding. What do we do after we have a nosebleed, or just to prevent them altogether? So when we get to that place where we are having super runny nose, we know allergy season is coming, our kiddos are just runny noses everywhere. Let me put my glasses back on so I can see again. So we know we have runny noses everywhere. Then we are going to start doing lots of nasal saline. Nasal saline is great for two things. One, it rinses out all of the allergens in the nose. We can even do a nasal flush where we take one of those bottles or something and stick it in the nose and we flush it, and it goes in the one side and through the sinuses, rinses out the sinuses, and out the other side. And that is a fantastic way to keep the sinuses clean, the nasal passages clean, and it rinses out any of the allergens in there. The other thing it does is it keeps it nice and moist in there. So we're going to do that. We're going to clean everything out, whether it's just the spray or the flush, and then we are going to put a little bit of Neosporin on a Q-tip or something, and we're going to put it in the nose. Now, we are not talking about putting it all the way up to here. You see where the round, I guess I'll take my glasses off again. You see the side of my nose, there's like this little round bump here, right? And then we're gonna put the Q-tip into about here. Right around here is where those blood vessels are, so we just have to go to here. We're not going up here, not going like way, way high. It's just very small. Quite honestly, probably most of us have kids or ourselves put our fingers up much higher, right? It is not very far at all. So you're just gonna take a little bit of Neosporin or a little bit of Vaseline, and you're gonna put it in the nose in those areas. And that's essentially like chapstick on our lips. We are just gonna keep it nice and hydrated. And that's what we do. If we are having too many nosebleeds, more than several times a week, more than 3-4 days a week, and we are doing all of these things, the nosebleeds are not getting better, or even doing all of these things, even stopping the nosebleeds in the right way, it's still bleeding for more than 15 minutes, you definitely need to talk to your pediatrician, and we may need to send you on over to an ENT to take a look at that to see if we just need to cauterize that skin. Maybe that skin is just too thin, too weak, and it just needs a little bit of extra help. So that is my talk on nosebleeds. If you have any questions, definitely let me know. If you happen to be looking for a pediatrician in the Lithia, Florida area, we are Blooming Bright Pediatrics, and we are accepting new patients right now, so definitely check us out. We would love to take care of you and your kiddos. We are a concierge practice, which means that you get direct access to me, yours truly, Dr. Jessica Chacko, board certified pediatrician. You have access to me 24/7, 365 via text, via phone, via email. We do home visits, we do office visits, we do telehealth visits, and it is truly a life-changing way of having a doctor in your life. And it's essentially like having a doctor in the family. I think of all of my families as my family. We talk, we chat, and they can reach out at any time, and I will get back as soon as I can if I don't pick up right then. I hope this was super helpful, and I definitely look forward to chatting soon. And if you need anything, let me know. Talk to you guys soon.